Imagine going through your day with an invisible fire burning inside your stomach. Every meal ignites discomfort, every moment of stress fans the flames, yet the pain is often dismissed as just another bad day or a simple upset stomach. This silent agony isn't just a fleeting discomfort. It's a warning sign of gastritis, a condition affecting millions worldwide. Left untreated, this smoldering fire can lead to dire consequences, transforming from a manageable condition into a life-threatening emergency. Today, we're diving deep into the hidden dangers of untreated gastritis, unveiling why this common but overlooked ailment deserves your immediate attention. Because what you don't know can hurt you, and in the case of gastritis, the risks extend far beyond simple stomach pain. We will talk about what happens when gastritis is left untreated, what gastritis is, what causes it and how it develops, so please watch to the end and do not forget to like and subscribe. If you are new to my channel, I am V and welcome to the best health channel on YouTube where we talk about everything related to your health and well-being. My videos are aimed at promoting health worldwide using YouTube, and I can only do that with your help, the viewers, who watch and engage in my videos. What happens when gastritis is left untreated? What are the consequences or complications of ignoring the symptoms of gastritis? Peptic ulcers. Untreated gastritis can escalate beyond mere inflammation, leading to peptic ulcers. These are painful sores that form on the stomach lining or the initial part of the small intestine, known as the duodenum. Symptoms can include a sharp, stabbing pain in the stomach area, which may become more pronounced when the stomach is empty. These ulcers are not just painful. They can lead to serious complications, including bleeding and perforation of the stomach wall, necessitating urgent medical care. Stomach bleeding. When the protective lining of the stomach is compromised due to ongoing inflammation, it can lead to stomach bleeding. This condition might not always be immediately noticeable, but it can cause vomiting of blood or black, tarry stools, symptoms that require immediate medical attention. Chronic bleeding can lead to anemia, making you feel tired and weak, further complicating your health. Increased risk of stomach cancer. Chronic gastritis, especially when linked to a persistent infection with Helicobacter pylori, a common bacterial cause of gastritis, significantly increases the risk of developing stomach cancer. This risk is compounded over time with continuous inflammation acting as a catalyst in the transformation of healthy cells into cancerous ones. Recognizing and treating gastritis early is crucial in reducing this risk. Other complications. Beyond ulcers and cancer, untreated gastritis can lead to other health issues, including iron deficiency anemia and vitamin B12 deficiency. These conditions arise when the stomach's ability to absorb nutrients is hindered by inflammation, leading to fatigue, weakness, and other symptoms that can severely impact your quality of life. Now that we understand the severe risks of untreated gastritis, what exactly is this common but often misunderstood condition? Gastritis is a medical condition characterized by the inflammation, irritation, or erosion of the stomach lining. It can occur suddenly, known as acute gastritis, or develop slowly over time, leading to chronic gastritis. The stomach lining's role is crucial. It produces acids and enzymes that help in digestion. However, when inflamed, it can't perform its functions properly, leading to the symptoms many dismiss as mere discomfort but are actually signs of a deeper issue. How can you develop acute gastritis? Acute gastritis often starts suddenly, possibly due to damage caused by certain medications, like NSAIDs, non-steroidal anti-inflammatory drugs, like ibuprofen, or excessive alcohol consumption. It can also be triggered by infections, stress, or injury, leading to immediate symptoms of pain, nausea, and indigestion. And what about chronic? Chronic gastritis develops more slowly and can be the result of prolonged irritation due to factors like Helicobacter pylori infection, a common bacterial cause. Persistent use of irritating substances like NSAIDs, or conditions such as pernicious anemia, can also lead to chronic gastritis. Over time, the stomach lining wears down, potentially leading to the complications we've discussed earlier. Helicobacter pylori, or H. pylori, deserves special mention as it's a key player in many gastritis cases and a prime example of how gastritis can develop into more serious conditions. This bacterium burrows into the stomach lining, causing inflammation and, over time, increasing the risk of ulcers and even stomach cancer. Its role highlights the importance of diagnosing and treating gastritis early to prevent these outcomes. Now let's look at the common causes. Helicobacter pylori, H. pylori, infection. The most common cause of chronic gastritis is an infection by the bacterium Helicobacter pylori. It can burrow into the stomach's mucus lining, leading to inflammation. While it doesn't always cause symptoms, in some, it can lead to ulcers and increase the risk of stomach cancer. Regular use of NSAIDs. Non-steroidal anti-inflammatory drugs, such as ibuprofen and aspirin, can cause both acute and chronic gastritis. These medications weaken the stomach's natural protective lining, making it more susceptible to acid. Excessive alcohol consumption. Alcohol can irritate and erode the stomach lining, leading to inflammation and even bleeding. This effect can be acute or become chronic with long-term use. Autoimmune gastritis. In some cases, the body's immune system attacks the cells in the stomach lining. This is more common in individuals with other autoimmune disorders and can lead to vitamin B12 deficiency and pernicious anemia. Other causes. Other causes can include stress, bile reflux, infections other than H. pylori, and consumption of corrosive substances. Chronic stress, for example, has been linked to inflammation in the digestive system. Apart from these causes, certain factors can put you at risk too, factors like age. Older individuals are more likely to develop gastritis because the stomach lining tends to thin with age. They're also more likely to have an H. pylori infection or autoimmune conditions that can lead to gastritis. Lifestyle choices. Habits such as regular use of NSAIDs, excessive alcohol consumption, and smoking can significantly increase the risk of developing gastritis. Existing medical conditions. People with autoimmune diseases, chronic stress, or other digestive disorders like Crohn's disease are at higher risk. Diet. A diet high in spicy, acidic, or fried foods can irritate the stomach lining and may contribute to the development of gastritis. You might be asking if you can move from having acute gastritis to chronic. Yes, and here is how. Acute gastritis starts suddenly and typically has a more severe onset of symptoms. In most cases, acute gastritis is a temporary condition that can be resolved with treatment or by removing the irritant. Symptoms include sudden and severe stomach pain, nausea, and vomiting. If the causes of acute gastritis are not addressed, or if there's a continuous exposure to irritants like H. pylori infection, the condition can progress to chronic gastritis. This transition occurs as the stomach lining continues to be inflamed over a prolonged period, leading to lasting changes in the stomach structure and function. Chronic gastritis develops slowly over time and may not always present clear symptoms, making it more insidious than its acute counterpart. It's characterized by a gradual weakening of the stomach lining, which can lead to complications like ulcers, bleeding, or even an increased risk of stomach cancer. Chronic gastritis can be caused by persistent infections, autoimmune conditions, or prolonged exposure to irritants. The progression from acute to chronic gastritis underscores the importance of early intervention and treatment. Recognizing and addressing the symptoms and causes of acute gastritis can prevent its evolution into a more serious and less reversible condition. Understanding the progression from acute to chronic gastritis sets the stage for recognizing the symptoms associated with this condition. More importantly, it underscores the need to take these symptoms seriously, as neglecting them can lead to severe complications. Let's explore the key symptoms of gastritis and link each to its potential consequences if left untreated. Symptoms of gastritis and their potential consequences. Abdominal pain or discomfort. Often described as a burning or gnawing feeling in the stomach, especially between meals or at night. Persistent pain can indicate the development of ulcers or more severe inflammation, potentially leading to bleeding or perforation of the stomach wall. Nausea and vomiting. A common early sign of gastritis, sometimes accompanied by vomiting. Continuous nausea and vomiting can lead to dehydration, weight loss, and electrolyte imbalances, further exacerbating the body's overall health. Bloating and early satiety. Feeling full after eating only a small amount of food, accompanied by bloating. These symptoms can worsen, affecting nutrient intake and leading to nutritional deficiencies and weight loss. Loss of appetite. A decreased desire to eat, often due to stomach discomfort or pain. Long-term loss of appetite can result in significant weight loss and malnutrition, weakening the body's ability to fight infections and perform daily activities. Black, tarry stools or vomiting of blood. Indicators of bleeding in the stomach, which can appear as black, tarry stools or vomiting of blood. This is a sign of advanced gastritis and can lead to severe blood loss, anemia, and in critical cases, shock. Each symptom of gastritis, while potentially mild on its own, carries the risk of escalating into far more serious conditions if left unaddressed. Recognizing these symptoms not only in ourselves but also in loved ones, and taking prompt action, can prevent the development of severe complications, underscoring the critical importance of early intervention. As we reach the end of our journey through the complexities of gastritis, from its causes and symptoms to the potential dangers of leaving it untreated, we hope you've gained valuable insights into this common yet often overlooked condition. Remember, recognizing the signs early and seeking medical advice can prevent the progression of gastritis and avoid serious health complications. We thank you for watching and dedicating your time to better understand the importance of addressing gastritis. If you found this information helpful, please don't forget to like and subscribe to our channel. Your support helps us create more content that can make a difference in your health and well-being. Remember to take care of yourself and your body and have a great day.